Hello, my name is Christy Sherrill. As a proud Marine Corps veteran, I would like to welcome you to the Rural Veterans Health Access Program training module that addresses the challenges women veterans face associated with alcohol and drug addiction, which we will collectively refer to as substance use disorders or SUDs. In this video, we will address several objectives. We will identify the devastating statistics relating to women veterans struggling with substance use disorders. We will explore factors causing our military women personnel to turn to and often misuse drugs and alcohol during and after military service. We will discuss the widespread negative impact on military culture and community health systems from this addiction crisis. And finally, we will share current treatment and support programs. It's time for the healthcare community to gain a broader awareness of the unique challenges that women military personnel face as they fight addiction. We thank you for making the time to view this video and your ongoing commitment to our veterans. The references section at the end of the video provides many resources to help expand knowledge of this complex issue. Here are a few statistics concerning the total veteran population and addiction. Over 1 million veterans are currently living with SUDs. More specifically, 80% struggle with alcohol abuse, 25% struggle with illicit drugs, and 7% struggle with both alcohol and drugs. Not enough comprehensive data is known yet about women veteran statistics, but a study of 1,000 female service members was conducted from 2010 to 2011, exploring the relationship between rape, sex partnership, and substance abuse in women veterans. We will explore the findings later in this video. Unfortunately, heavy drinking is sometimes an accepted practice and an integral part of military work culture. Certain drugs can be readily available in combat theaters. The Department of Veteran Affairs has struggled for over 20 years to combat the increasing rates of SUDs. Chronic injury necessitates prescription involvement, especially with so many veterans developing PTSD from combat trauma. When these conditions collide, veterans often become addicted to medications as they try to escape the physical and emotional pain, which increases suicide numbers. In addition, in an effort to reduce pain as well as help to cope with battle tension, the misuse of prescription drugs has increased as well. The National Institute on Drug Abuse recently conducted a study reporting on the economic impact on opioid addiction among service members. The results indicated the total costs from opioid addiction are roughly $1 billion a year, and for heroin use, $470 million. Nationally, drug and alcohol use in the United States costs $1.5 trillion in economic loss. Thousands of military personnel, including women, are among those impacted. Veteran substance abuse impacts interpersonal and professional relationships, especially when veterans are transitioning back into civilian life after discharge. Earlier in this video, we mentioned a study which involved over 1,000 Midwestern women veterans. In this study, interviews were conducted to assess demographics, rape history, substance use dependence, depression, and PTSD. 1/3 of the women veterans met lifetime criteria for SUD, half reported lifetime completed rape, 1/3 childhood rape, 1/4 in military rape. Lifetime SUD was higher for women with rape history. Women with women as sex partners had significantly higher rates of all measures of rape, and also lifetime SUD. Post-military rape, sex partnership, and current depression were significantly associated with lifetime SUD in multivariate models. In another study, results showed that many women veterans have a high need for comprehensive mental health services. Higher instances of complications with pregnancies, hypertension, divorce, and homelessness occur as well. The original Title 38 United States Code included the Educational Assistance Program for veterans serving in many war theaters, including Vietnam, Iraq, and 9/11, as well as family members whose loved ones made the ultimate sacrifice. Also included were employment training and rehabilitation, housing and small business loans, and adaptive equipment for certain disabled veterans and members of the armed forces. H.R. 2915 is the amended Title 38 United States Code, which, for the first time, directly addresses the unique mental health needs of women veterans. This is an important step forward, but much more is still needed to fully support the unique challenges women veterans face as a result of military service. During the 2021 VA Healthcare Summit, presenter Dr. Jennifer Strauss, Director of the National Women's Mental Health Program, presented updates on recently implemented treatment programs and why it is so critical to continue to expand on programming related to women veterans' mental health. Dr. Strauss reported that a comprehensive 2020 study stated that 44% of female patients in the VHA confirmed mental health diagnosis, compared to 26% of male patients. Women veterans reported higher rates of depression and anxiety, medical comorbidities, and fewer resources available to meet their complex health challenges. Dr. Strauss also reported that the VA offers extensive coordination of services for women that are rarely available in the private sector. She emphasized during the summit that over half of the VA mental health clinicians at the VA are female, which is highly relevant since most women veterans express a preference for same-sex providers. The VA offers treatments with a primary focus on women's reproductive mental health issues as well as eating disorders. To support ongoing research, the VA offers clinical training in these specialized areas. In addition to clinical training for providers, the Women's Mental Health Program offers 2 programs for patients. These trainings are STARE and Parenting STARE, which are cognitive behavioral trauma treatments that teach skills for managing strong emotions and building healthy relationships, including parenting relationships. The Women's Mental Health Program also tackles the tragic crisis of women veteran suicide. Dialectical behavioral therapy, or DBT, is an evidence-based intervention for reducing suicide attempts and non-suicidal self-directed violence, such as cutting, with extensive research support. This intensive resource is offered for both patients and providers. In summary, addiction is a complicated disease with several causations. Medical providers must carefully consider which methods of care will best suit the patient. As has been explored in this video, new treatments are now available. The proper course of treatment should be determined after a thoughtful and comprehensive medical and mental health assessment is conducted on each woman veteran. On behalf of the RVAP team, we would like to thank you for your dedication to the veteran population by participating in this training module. Please be watching for the 10th and final video in this series titled Challenges That Military Families Face. If you have additional questions, please feel free to reach out to the email shown here.